Hello and welcome everybody from across the world joining us live on Facebook for our show, Pulse by HealthJobHub. My name is Prashanthi Naidu, founder of healthjobhub.com. I started Pulse to connect, share, and inspire. My mission is to unveil the pulse behind the pulse. Today, I have a very special guest joining us live on Pulse. It is my honor and privilege to welcome Dr. Dave Sinha, all the way from Calgary, Alberta, to our show this morning. Good morning, Dr. Sinha. Thank you for joining us. How are you this morning?
Doing well. Good morning, Prashanthi. Thank you for having me on the show.
Oh, it's indeed our pleasure. Tell me, have you had a chance to have a smoothie or, get your morning routine going?
I have.
Awesome. Well, I'm so delighted that you were able to join us this early. To all our viewers, Pulse by Health Job Hub is a live talk show. So if you have any questions, please ask. I'd like to thank our sponsor, healthjobhub.com, for sponsoring this show. In response to COVID-19, healthjobhub.com has opened up our platform to all employers during this time of need to post unlimited jobs. Dr. Dave Sinha, medical doctor and founder of Synergy Collaborative Health. He completed his medical degree from the University of Alberta and his postgraduate training in family medicine with the Rural Alberta North program. Exposure to the breadth of primary care in underserviced areas provided the foundation for his current practice in procedural medicine, psychotherapy, and comprehensive primary care. His latter experiences with MediCenters, Integrative Medicine Institute, and Oasis Health Systems inspired him to pursue training in a multitude of disciplines, spanning the scope of healing from prolotherapy and functional medicine to minor surgery, women's health, and hypnotherapy. He began to develop a greater appreciation for the role of consciousness in healing and how health issues were intimately connected to the deepest issues of the heart. He observed how these unresolved patterns would emerge through imbalances of behavior and biochemistry to ultimately manifest as disease. He learned that patient engagement as well as community play an essential role in healing. Wow, this is an impressive bio, Dr. Sinha. Congratulations on all the outstanding work and research that you're doing.
Well, thank you kindly.
Please share with us your story about what inspired you to pursue a career in medicine and to become a physician.
To be honest, I think medicine has always been my inspiration.
Yes.
I was actually speaking to my father recently, and he was sharing with me a story of when my grandfather, or Baba, had a stroke and was paralyzed on his left side. And he said that even as a 3-year-old, I would come and spend a lot of time with him. And he said other children were not as comfortable seeing a grandparent like that. But he said I would sit with my grandfather and I would actually sort of hold his hand or place my hands upon him. And there was a very pensive quality, as if what I felt was doing something therapeutic. So it seems that right since I was a child, there was this incredible admiration for the profession. And even I think of these great sort of personalities that we're raised with, stories of Mahatma Gandhi or various figures. And what's common to all of them is this importance of healing. Healing almost shown as a miracle that I think sometimes is in the profession we can begin to lose sight of. And so I think that as I got older, I recognized it more and more that there would be something that we'd have to pursue as a career in life. And something that came to me as being probably paramount was something that wouldn't harm others. And interestingly, in medicine, our first principle is primum non nocere, to not harm. And I think another principle that emerged for me was something that would truly be of service, something that would help others. I think this is the ultimate foundation, essence of medicine.
Mm-hmm.
And finally, I think one of the things I was looking for was a path to what people might describe in different terms. We might say self-actualization or enlightenment or self-knowledge. And I feel medicine as well can be a unique path in that regard. And that really inspired me. I've heard a saying once, that stuck with me. And they said it was, a priest sees someone at their best, a lawyer sees people at their worst, but a physician sees people as they really are. And it's that breadth of humanity, that breadth of experience, right from infancy to people in the last days of their life, having proximity with death and dying and illness and suffering. I think it really gives an insight into the human condition, and also it's very humbling to be a part of something so profound as healing.
Absolutely. Wow. That is one of the most beautiful, inspiring stories behind why you chose this career that I've heard. And you've articulated it so well and so beautifully. Thank you so much. I'm sure there's going to be lots of young people out there who hear you the way with the way you explain that inspiration, and also it's a calling almost that I feel that you've had since you were young. So thank you so much for sharing that. It was beautiful.
Thank you.
The scope of your practice in Cochrane, Alberta is as diverse as the patients you serve, from integrative medicine to psychotherapy to procedural medicine and medical anesthetics. Please share with us some of the innovative new procedures and therapies you offer at your clinic.
Well, thank you for asking. And I think in one way, the therapies, there's always innovation. Innovation is perpetual, but I think that these things are as old as the sun, that there's nothing necessarily innovative in one regard, and yet there's always innovation in the midst of all that we're doing. So yes, my practice is quite eclectic. It's an evolution from, one might say, a rural family practice where procedures and more specialized care were present, to my own personal interests and things like integrative medicine and consciousness. So it's an eclectic practice. On one hand, we do a lot of primary care procedures, and that can range from things like Botox for migraines or hyperhidrosis. We do a lot of minor surgeries, vasectomy, IUD, endometrial biopsies, lumps and bumps, radiofrequency procedures, if people have lesions on their face or eyelids, things like that. Another big part of the practice, which may be considered a bit innovative, is prolotherapy, or PRP, the use of platelet-rich plasma. And so I think many physicians are very familiar with steroid and viscosupplementation of joints, but the use of prolotherapy and PRP is considered to some maybe more novel. I had learned prolotherapy from Mark Wheaton in Minneapolis, and so I was really fortunate that I had an exposure to very traditional prolotherapy in the sense of the assessment, the approach to disease, and also the treatment. So that's another really neat procedure that I offer in my practice.
Mm-hmm.
Of another aspect of my care, one of my true passion in many ways, is the psychotherapy and hypnosis in particular.
Mm-hmm.
Hypnosis was something that almost found me, and I just absolutely love it and its potential and its role in medicine. And specifically, what would be considered some of the more advanced hypnosis techniques of regression, Gestalt therapy, using hypnosis for overarching insights and understanding of themes and conditions. So that's another really neat offering in the clinic, and has become a really unique offering in our practice. In terms of use of mindfulness, mindfulness has become a household term, but I was not aware of the applications of mindfulness in therapy.
Mm-hmm.
We have actually a program where we apply certain aspects of mindfulness in the treatment of various more mental health disorders. Another is internal dialogue, which can have components of CBT, of hypnotherapy, but is sort of a profound dialogue that a patient can conduct and can be facilitated, but it can also have therapeutic value. And also teaches sort of a skill and an approach to our own internal dialogue, while providing a therapy that they can see even in that first encounter, a resolution of an issue. So these are some of the main therapies that are in my practice that have emerged. In terms of the team, there's been a really unique collaboration, interdisciplinary integration that's happened. And we have a really unique team where we have ophthalmology, Dr. Khosla and Holly Sidhu, who's doing family medicine. We also have Nee, for example, who is a family physician of 15 years experience, but is actually practicing as a naturopathic doctor now. So someone who really has both perspectives. And it's really neat to have Harpal and Kulvinder Rojewal, who are Ayurvedic physicians, and they bring a neat perspective. I almost think of Ayurveda as almost being like the root of medicine or the origin of one of the most ancient healing systems. And some of the perspectives they have on illness and perspective and consciousness and all of these elements is very profound. It's a very unique aspect that they bring. And then we have other people in our allied team. We have a nurse practitioner who does injectables, things like Botox filler, things like that. So there's a whole breadth of medicine, right from innermost to outermost. And it's neat to see that all sort of integrated at synergy.
That is absolutely fascinating. And I love the fact that you've integrated naturopathic medicine, with the traditional, medicine that you follow, becoming a medical doctor. And I love this holistic approach you are taking, combining all the different elements of healing and therapy to provide a holistic treatment plan for your patients. That is wonderful and outstanding, and I would love to experience that as well. So thank you for sharing that. And I love the fact that you have this multidisciplinary team around you, so you can really be able to offer that targeted help to people in the best way possible under one roof. So hats off, fair play.
Thank you. This was very much our concept that definitely surgical interventions and medications have a critical role, and they represent that sort of most gross manifestation of the disease. But even those we know have originated from a biochemical imbalance. And so, for example, the functional medicine elements where, for example, Nitan in our team, who has the naturopathic and medical background, who can really shed some light on what is this. Maybe there's an issue with dysbiosis or disruptions of flora that were upstream that led to these disruptions in the body. And then even some of those disruptions, they may be originating from perhaps people's behaviors. And maybe their stress, which may have caused their cortisol to rise and their neurotransmitters to be disrupted. And so there we have a team member, Annemiek Ardoum, who's a psychologist who specializes in somatization, how physical conditions become mental emotional conditions, and mental emotional conditions can contribute to our physical health. So she really explores that avenue and maybe the behavior element behind it. Also Candice Word, she's a nurse counselor who also focuses on nutrition and functional fitness. And so that element, using various modalities, including hypnosis, to look at some of the dynamic in between that biochemistry and the psychological realm can be really profound. And then again, as I said, Ayurvedic medicine, which really looks at someone's core constitution, their core orientation, and what sorts of psychological and physical and behavioral choices flow with that, and how we can bring that into balance. So it's a very profound synergy right from those most original upstream causes. In Ayurveda, they don't even really focus on the symptom often. Their focus is to restore the most fundamental balance. So we see this downstream resolution.
Wow. And your name of your practice encapsulates all what you do so beautifully, Synergy Collaborative Health. So yes, that's beautiful. We actually have a question from a viewer, and I'm going to try and show that on the screen right now. Our viewer would like to know, you integrate hypnotherapy in your practice. What is your success rate with your patients using hypnotherapy?
So yes, no, thank you for the question. It's a great question. And there's, I would say, two main domains where we're using hypnotherapy. So would be, one is in mental health, whether it's addictions, whether it's sleep disorders, or unusual psychiatric disorders, or unusual, very specific issues. Examples could be someone who has a very specific phobia. So we recently had a patient who had a phobia of spiders, who had a phobia of moths. We had another who had a phobia of moths. We had a patient who, for example, could have a very unusual problem that he says they don't have depression or anxiety, but whenever they, for example, play for their soccer team, they only play their best when the team is tied up or when they begin to lose. And then they're able to, so it was actually a young child, and he said suddenly he will be able to perform at a much higher level and tie up the game or get a point lead. And then immediately upon achieving that, he'll regress to sort of a poor performance. But even things, long-standing mental emotional issues, these are all wonderful instances where we use hypnosis. Another is probably more complex chronic conditions. Perhaps one might say there might be a psychosomatic component, but even otherwise, hypnosis can really bring a new perspective. It can really shed light on what is it that might be behind this. In a way, we could sometimes think of an illness as being an opportunity to learn something, that the illness is there for perhaps to shed light on something in our life, to bring something to our attention, perhaps something that we didn't pay attention to, or was something that was unresolved within us. And so hypnosis will often, in a very direct way, a very non-speculative way, bring attention to that. It'll often shed light on traumas that took place and belief structures that developed around those traumas, and how that might even tie into some of the issues that are taking place very much more in the present. So we've used it for both physical disorders. It could be something like chronic pain, who has a disorder which has not responded well to medical care or is persisting, but it could be very major illnesses as well. We've seen people with MS where there's not a psychosomatic component have great relief. In terms of the success rate, I would say very high. To be honest, I found, depending on the type of hypnotherapy approach we took, we could get increasing success. So if we use, for example, direct suggestion, I actually found that success was quite limited. However, when we began to incorporate techniques like the regression or the Gestalt therapy, or for example, using hypnosis to access an overarching insight, I found that the success rate became increasingly higher. And we were able to have phenomenal results, to be honest. Often it'll shift the condition, even something very physical, something very gross, something that is not apparently psychosomatic. And often is after we've completed a course where we've looked at things, different layers and perspectives, there will be a profound shift in the condition. That suddenly we will start winning, in other words. And there'll be something that shifts. Recently I had a patient, and she was a young woman who had a spider phobia. So that's how it started. And she came, and we did a session first focused on spider phobia. But we also noticed then that her anxiety generally began to resolve, and some relationship issues began to resolve. We had another very recently. She came, she has ankylosing spondylitis, chronic migraines, extreme rage. She's disabled, in fact, from her work. She was actually a former healthcare provider, and even began to develop sort of increasing symptoms, sugar addiction to any food containing a lot of sugar. So her diet and nutrition began to deteriorate further and further. And we started actually focusing on the rage. And she, after a single visit, she said this rage, which had been there for 15, 20, 30 years, had completely resolved. She had not had instances of rage. And she had not anticipated that the things like the sugar, the addictions to sugar and certain nutritional choices would shift, but that shifted as well. Her migraines diminished tremendously. And the ankylosing spondylitis was flared significantly since we'd seen her last. But she said normally when her ankylosing spondylitis would be flared, it would be like her whole mental emotional condition would deteriorate, that she would really struggle. But in this instance, she said over these past several months, despite having substantial symptoms, mentally, emotionally, I was resolved. I was not, it didn't seem to become a mental condition. And she came for her second visit then recently. So it's a very profound treatment. People may have heard of the adverse childhood event studies. And that's really a neat study which really sheds light on the role of trauma in all sorts of disorders, mental and physical. And I think hypnosis is such a unique modality to really look at that. And there's now increasing science. There's a lot of evidence for hypnotherapy and very good evidence in support of it. So it's really neat to see this coming together, and the potentials are amazing. So yes, in summary, we can use it for a broad range of conditions, and it can have a tremendous success rate. It can contribute something very profound, a different perspective on the illness. And that can translate into both mental, emotional, and even physical healing.
Wow, that is incredible. In fact, I don't really know many other clinics that offer such a service. Bringing hypnotherapy and making it part of the holistic health plan for your patient. So it sounds extremely innovative. Thank you for sharing those amazing stories and the recovery of your patients as well. I hope a lot of people who are listening in will be inspired by the therapies that you do provide. And I believe you do provide it virtually as well, especially now during COVID.
Yes, we're providing it through Zoom, or now through our electronic medical record actually has a teleconferencing feature. So we're providing it through that as well.
And tell me, like, if people, and I'm just throwing this out there, like we have viewers from around the world that's tuned in. So if somebody from South Africa, for example, or like another part of the world wanted to connect with you because of that treatment, can they?
Yes, in fact, that is something that we had not entertained, or never occurred to us till this time. But suddenly doing the treatments, I think again one of the neat blessings that has emerged, or some of the insights that have emerged through COVID, has been that actually we can provide virtual care, and even virtual care in psychotherapy, something we had not considered before. So it is definitely a possibility. There's no barrier anymore with our technology today to treat.
Yeah. That is absolutely amazing. And I'm sure if there's any viewers that's interested in connecting with Dr. Sinha, you could do so on our link. We will have his Facebook page, and you can contact him for more information, because I think it's outstanding work you're doing. It's absolutely fascinating, and I hope people take advantage of the service that you provide. It sounds absolutely amazing. In creating Pulse, one of our goals is to have our finger on the pulse. How is your community and your practice being impacted by COVID-19, and how has it been for you working during this pandemic?
That's a great question. I think definitely the impact on the community has been profound. I think, as we see probably globally, many services are shut down. I think people are maybe finding it very difficult to access their friends and family. Mm-hmm. There's a degree of concern about what could happen with an infection, what could happen to a loved one who gets infected. Many people are concerned not even about themselves, they're concerned about infecting others. So I think that the effect has been profound on the community, and Cochrane is not an exception. And there have been some cases, in fact, in Cochrane as well. So I think there's been a profound effect. I think many services have been shut down. I think there's economic impact. So I think there's definitely been an impact on the community. But there's also been an amazing coming together of community. It's been an opportunity in many ways. There's a restaurant just beneath our clinic, Metab, and they're actually providing meals free of charge to people who are going through a tough time. It's an amazing contribution. We were practicing, had a busy day at the clinic, and suddenly we heard all these horns all this honking, and looked out the window and saw a fleet of cars come to the parking lot, and I think it was police and firefighters, and they were supporting the healthcare team and sort of kind of cheering people on and saying, thank you. So in many ways, I think the community has been coming together. The masks that we're using at Synergy are now being made by people in the community actually for us, and there's been such an outpouring of support in that way. So I think that there's been a tremendous coming together of the community, and I think something like this, maybe we might say crisis of this magnitude that really shakes things up, is almost as equally profound an opportunity for service and for self-reflection. So I think there's been a tremendous impact on the community, but I think there's much positive that could be gleaned from it as well. In terms of my practice, in one way, things have been fairly similar. In fact, we still have some of the procedures which are more essential. We're still providing those. Some of them we've put sort of on postponed. Some of the elective procedures we've rebooked. We're doing a lot of care by telephone, by Zoom, by teleconferencing. And that has been a great experience, actually. It's actually shown just how much we really can do. We've been assessing people's pharynx, and they'll take a picture on their phone and send it to us, and it's actually a great image. So, to be honest, it's been amazing. Even for myself, the discovery that hypnosis could be conducted over the phone. I didn't realize that. I would always be concerned that if I can't see the person, maybe there'd be a loss of connection, but there's been no problem. There's been no barrier. And similarly, even I think, even recognizing the degree to which we can actually treat using imaging, and even having to be maybe judicious in our resources and thinking about what is really essential in terms of imaging or blood work or treatments. So I think it's been even from a medical perspective, a good exercise to go through. So I think there's been an effect on the practice and our patients as well. We've seen as a substantial part of my practice is psychotherapy. We have had some patients who are really struggling. Some have said that this is very difficult for them. They can't access their normal coping strategies, the things that they enjoy. We have others who have felt that they're really enjoying it. They actually realized how many of the things they were engaged in were not essential. We've had actually people I know who had large weddings planned, and this whole crisis made them really reevaluate. And obviously they had to let go of those events. And then they realized it gave them a perspective that perhaps there wasn't that much value to it. And they actually were really happy and revisited this whole concept of having, for example, a giant wedding. So I think that there's been many profound effects. Some patients have been taking this period of almost self-reflection, of isolation, having to really face ourselves. We've actually had some patients who are using it as a period of retreat. We have something at the clinic called a wellness lifestyle. They're taking this period to say, I'm really going to embrace this wellness lifestyle and see what it would be like to conduct this. And maybe this again is an opportunity that I maybe wouldn't otherwise be able to comply with because there'd be too many distractions that would pull me out of my center and pull me out of the opportunity to really stick to something like this. So some patients are finding it a great opportunity and a profound deepening of their sense of well-being. Some patients are struggling. So again, all different perspectives, but definitely the impact has been profound. I think it, again, at the very degree to which it is a disruption is also the degree to which it's an opportunity.
Absolutely. I love that. In every missed opportunity, you find the opportunity and you make it work. That's great advice. And I love the way the community is coming together as well. And the patients taking that time to reflect and, to find what's important to them during this time. That is absolutely brilliant. What is your medical advice that you could share with all of us who are staying home and now anticipating the end of the lockdown? What would you caution us, or what advice could you share with us?
Yes, in terms of the end of the lockdown, that is a very unique question. And I wonder if we will probably be getting some guidelines, actually, how to proceed with social distancing, what precautionary measures to take. And I'd be curious to see what will emerge and what will come from those guidelines. In terms of the question, when you mentioned afraid of the COVID, there's a couple of metaphors we use with patients in the clinic that come to my mind. One is that I'll use the Grand Canyon, and we'll say that no, fear is like standing near the Grand Canyon, and that if we're right at the edge with our toes hanging over the edge, we'll probably be feeling a little bit uncomfortable, probably have some fear, and legitimately there is some risk. There could be a gust of wind or a slip, and we may find ourselves sort of off balance. And if we could stand 100 feet back from the edge of the Grand Canyon, we'd be very, very safe. However, even something as vast, as large as the Grand Canyon, we could actually lose sight of it. Yes. And probably at 3 feet, we probably have most of the protection of being at distance, and yet the view is preserved. We haven't lost perspective. So I think this is a great way of addressing fear. I think that there's an appropriate degree of precautions to take as an overarching principle, but this can be an opportunity to really see how engaged could we be in something that's appropriately cautious without being necessarily disturbed by that fear. So, for example, we've had some patients where we had them do, for example, have a dialogue with themselves and take different behaviors and write out what they think would be an appropriate precaution to take. Maybe you can put it in writing. or make a decision about what would be the appropriate level, what's their plan, what's their approach. And once that's been determined and they feel is reasonable and it's informed, to actually let go of the fear and simply comply. So that's one aspect. People can have this little internal dialogue and sort of decide, what is it that I'm going to do? What's my plan with regards to what precautions I'm taking and how I can comply with those?
Mm-hmm.
And as we know in medicine, fear can increase cortisol, it can disrupt our sleep patterns, it could lead to more disruption of our mood and even more reckless behavior. People might actually say that they get so disturbed that they say, I'm just going to throw caution to the wind and just meet with my friends and throw my social distancing sort of restrictions aside. So I think sometimes excessive fear can actually contribute to the problem, it can become part of the problem, it can make us lose perspective.
Mm-hmm.
So another aspect with fear is, which is again something that really emerges from the mindfulness applications, is that fear can be something that we can actually, again, use as an opportunity for healing. For example, if we look at what fear is fundamentally, it's the desire to not experience a thought or a feeling, particularly a feeling. In fact, we might think it's about a circumstance or we might think it's about an outcome, but ultimately those circumstances, outcomes may produce something within us, a feeling, thoughts, images, that would create discomfort. And we don't want to experience that discomfort. So we want to either get away from it or we want it to go away.
Mm-hmm.
And so that avoidance, fundamentally, that's at the root of anxiety, is something that can be really profoundly addressed with simply letting everything be as it is, sitting with some fear, letting it take us to the bone in a way, and allowing it to open and soften within us on its own, and to realize that it, just like any other experience, arises, is experienced and passes. And there can be a profound letting go and a depth and deepening and opening and softening that can take place. So in a way, I feel it's particularly something like COVID, which is something so much bigger than us, and yet something so tiny and all-pervasive, can be an opportunity for us to almost transcend something within ourselves, and just to even very warmly let go of the control that we don't have. And I think that's a very powerful experience, to almost learn to comfort ourselves outside of our comfort zone. And these are, I think, really experiences that can help us both through this crisis, but can also resolve deeper elements of fear, resistance within us. So I think that the fear is an opportunity to embrace it in a way, to meet it, to face it, to feel it, and be free of it. So these are some of the thoughts I would have about the fear. In terms of the role of medicine, definitely now we're seeing that there are some good clinical trials coming out about potential treatments that people have heard about. Azithromycin, hydroxychloroquine has been talked about. There's some antivirals that have been talked about. And similarly, with the functional medicine spectrum, naturopathic spectrum, there are thoughts of even basic lifestyle measures, getting adequate rest, healthy nutrition, but even botanicals that may have value, both in antiviral effect, but even the inflammatory effects and the lung effects. So there's definitely, I think, things that are emerging that could be of value, and certainly people could embrace those as well.
Thank you so much. You are certainly inspiring. All your thoughts and all the advice you have for us, especially on the mental health issues that you've raised throughout this conversation, has been absolutely exceptional. You know, it really helps open up the mind and helps us to take control a little bit of our feelings and to use it in a positive way. So thank you so much for inspiring us this morning. Do you have any final thoughts or any final messages that you could share with our viewers?
You know, particularly what comes to mind, kind of flowing from that topic of the COVID, is that in a way, one of the concepts in Ayurveda, for example, they talk about 6 different core origins of disease. And one of them is where there's a Sanskrit term called pragyaprag, that it's a mistake of the intellect. And what they're referring to is that in Eastern thought, the sense that we are actually, in fact, one, that we're all connected, that our sense of separation, even our experiences, our models of conceptualization of the world, time, space, causation, these are refractions of our mind in a way. And that this is actually one of the fundamental causes of illness, the sense of our separation, our lack of connection, our loss of connection. And so I think with the COVID, one of the things that even emerges is that maybe the actions, even in this case, quite literally in Canada, that of someone on the other side of the planet has such a profound effect upon us. And we see whether it was the current COVID-19, or if we look at SARS, at the H1N1 with the swine flu, or the avian flus, or we're seeing a real association of these pandemics coming back to zoonoses, to infections from other animals. And it really brings to light that in a way, not only the actions of, as a species, what we do, but even our interactions with other species and how we're treating other species on the planet has a profound effect upon us. In a way, let's say pangolins, which may have been something that prior to this, maybe many of us had never heard of what a pangolin was. We may have not even known that they existed. And yet, in a way, it's brought our civilization to its knees. It's brought our lives to its. So our actions against each species, against each organism on the planet, does have a profound effect upon all of us, that we are in fact connected. This unity is there. Mahatma Gandhi, there's a famous quote, I don't remember the exact quote, but the essence of it was, he says that you could understand the greatness of a nation and the progress of a society by how it treated animals. And I think the way that we treat those who are helpless, or who are don't have a voice, is a reflection of where we are in our consciousness as a species. So I think if there was maybe a message that to me really emerged from the COVID was looking at what we're doing with animal agriculture, look at what we're doing infringing on other species and our treatment of animals. I think that there's something there, that there's a message there for us. And I think it's important that we take that message. We take what it's telling us. And I think that's a very, perhaps again, there's an opportunity through this for us to really have an opportunity to reflect and make a change as a society.
Absolutely. And you are one of the first guests to actually touch on that interrelation between species. And I love your perspective on that. And I think that for us as humans, we really need to be accountable for our actions and responsible and understand the implications of what we do and not be reckless. And this is probably what's happened with COVID. We might have done things that were reckless in the past, and now we are paying the price for it. But it brings us to another level of consciousness. And thank you so much for, opening our minds to that, because up to this point, I didn't think of it that way. And you really bring a unique perspective. Thank you so much, Dr. Sinha. It's been an absolute pleasure having you on the show. And thank you for enlightening us this morning and sharing your incredible story. You have been exceptionally inspiring.
Well, thank you very much, Prashanthi, for having me, and truly I appreciate giving such a forum for physicians to connect and to have our thoughts shared. Thank you so much.
Absolutely. And as I said previously, that if anybody would like to connect with Dr. Sinha, we will have his contact details and his Facebook link that you could direct message him, and definitely take up this opportunity. This brings us to a close of our Facebook Live show for Pulse by HealthJobHub. I really hope you enjoyed the show as much as I did. Please join me next week, same time, on Facebook Live. I'm excited to announce that our special guest joining us next week is Dr. Gopal Sampassad from Durban, South Africa, who will be sharing health tips how to cope with COVID-19 pandemic. Please join us next week again to be inspired. And don't forget, if you enjoy the show, please smash the like button, subscribe to our YouTube channel, and share with your network. Goodbye, stay safe, and God bless everybody.